My name is Nyachuat Deng. I'm known as Nyachuat Deng. First and last name where I was, but here I have to put Lam in order for people to really know who I am. And I came from U.S. About a year ago on the 10th this month. I'm working here at Juba Teaching Hospital as a mentor. They call it clinical tutor or clinical supervisor, something like that. I'm mentoring young college student, nursing college student. I grew up in Bentiu, Unity State now. My mother was a nurse. My father worked in school maintenance and whatnot. After the war, we left Bentiu. In 1982, we moved to Malakal, went to school, did the primary school, secondary school, and then later on at the brink of the war, 86, 87, we moved further north to Khartoum. The UN and IOM kind of helped us migrate it further to the Western world, to be exact, Sioux Falls, South Dakota. And I reside in Sioux Falls, South Dakota in, let's say, spring of 95. Up to now, I have children who are South Dakota who were born there. My first degree was nursing, and then I later on studied psychology. You're always connected to this land. Like myself, I always was connected to this land. I always wanted to come back and help if I have something to give. Last year, I came to just move here permanently with no job in advance, no salary, nothing. I just came here. Stayed with some of my relatives, walked around, looked for a job, and finally got a volunteer opportunity. Here I am. My motivation is a pride for my country. You know, I'm proud to be a South Sudanese. Yes, I'm an American by citizenship and nationality, but I will love this land, and I see that I have something to give. Since I have it, I will be proud to teach a student. And teaching is not like, you know, working on one patient. Teaching, you're teaching a lot of, you know, a number of students, and they go and you know, it's like a dominoes effect, and I like that part. So also I found out from my personal experience in Western world, if I didn't have people who guide me through the process, I will not be here today. So I thought those experiences that I have throughout almost 20 years that I spent there, I can do the same thing and then change lives. The big challenge that is here is lack of services, lack of, you know, human resource workers, quality workers. There is workers, but you know, there is a difference between workers and quality workers. I have a concept that I want to bring to this hospital is patient care. You know, we treat these people regardless of their tribe, because tribalism is big here, regardless of their financial status, HIV status, and things like that. And I noticed too that once they know that you have HIV status, people tend to shy away from you. And I'm trying to teach the student that no, the worst case is our best case as a healthcare workers. And I have some challenges down the road, but things are, I think I'm very confident that things are going to get better. Yes, you will struggle coming here, and you would even struggle with the identity. Like me, I'm partially American, partially South Sudanese. Those two worlds in a normal world will not mix, but because of who we are, the war kind of shaped who we are. And coming here, you are not going to regret it. There is a lot of need, especially in healthcare. I was dealing with a young child that kind of touched my heart. That young child had a cancer. It was a cancer in the arm. It was amputated and later on kind of radiated toward the chest. And that case, that particular case, if that is early detection, if there is people who are actually here to do that, I think we can save that one child. And that doesn't need to happen anymore. So if you really love your country and you think that this country should move toward a better future, it's not going to happen without you. You have to come and be part of it.